the proximal thumb here, you can get the dips and the pips, and you get the TMJ. So there's very few moves on this test.
Is it on?
You even got your hair?
Yeah.
I got my haircut the other day.
Look at all of them.
It's the first I've seen it.
Did you get a haircut or did you get them all cut?
This is the long one. This hair rolls out like this, and I'm going to tell you it's going posterior and lateral. Our adjustment's going to be intermediate, right? And it rolls, and so what we're going to do is we're going to roll it back with our thumb. We're actually going to put the force in with this joint. Their interphalangeal joint is what our contact point is. So when this rolls out, I'm rolling it back. I'm going to grab this proximal to the MCP here, and I'm going to thrust under, continuing that roll under as I lift this up. Okay, some people just grab it like this, do a thumb-on-thumb contact. There's so many different ways of doing it, just as long as you understand the misalignment component and how you have to correct it. Remember, if it's to the right, the restriction is right to left. You thrust through the restriction, put the bone back where it needs to go, whatever technique you choose. Okay, but that's what I want you to do tomorrow. The carpals, know what the carpals are, and I've told you the landmarks. Which one's by the thumb?
Trapezium.
Trapezium. And what's right beside that in the distal row? Trapezoid. And then what's next to that? Capitate, and then the hamate. And that's another landmark, right? Because you have a what on that hamate?
A hook.
A big hook. And you all know where the pisiform is. And then when you go down into that proximal row, the first one on the lateral side is the what? Scaphoid. And the lunate. And then underneath that pisiform is your triquetrum. Now, the one that they'll usually have you do on boards is the lunate. But I think last time somebody told me they had a posterior scaphoid. But I've heard it said, I've not really read it, but they'll say that lunate is the most common one that someone looks at that goes anterior. And so remember when you're looking underneath here and we're asking you on the test to point out your contact point, make sure you know which one's the lunate. A good way to find the lunate is how? Squeeze the hand together, follow the crease. Then when you find the bone, you're going to make your adjustment on it. I want you to stabilize the proximal on in radius. Do the thumb-on-thumb contact, open the joints with your other fingers, spreading them, and just thrust it through. Okay? And if it's posterior, same thing. Okay? Whichever bone it is, just figure it out. You can do that. The dips and the pips, generally I'm just going to have you say they're either going to go, it'll either subluxate laterally or medially, right? If it's gone lateral, then the restriction is going to be from lateral to medial, right? And I don't care if you adjust it supine, prone, just don't confuse yourself. Remember, the thumb is the lateral side, always the anatomical position. When you're going to make the adjustment, you're going to contact the proximal most portion of that phalanx. You're going to do it this way.